Good evening and welcome to Montgomery Heart Wellness Live. We did not post a clinical round this weekend because I want to come on and talk to you about certain medications that seem to be very popular. Many of you may be aware of the weight loss medications, Mounjaro, Ozempic, and I'm seeing a lot of patients come to my practice who have been prescribed these medications or they're asking for prescriptions for these medications. Now, as you all may be aware, obesity is a big problem here in the United States, and of course, associated diseases such as diabetes, type 2 diabetes in particular, and of course, high blood pressure and cardiovascular disease. These are common disease manifestations, or should I say, common manifestations of chronic illness. And oftentimes, it's thought that if you simply lose weight, you'll then reverse these illnesses, and there's clearly an association with lower weight and these illnesses. However, it's not as simply as losing weight. So what I want to do is talk to you about one particular drug and a drug family. And that particular drug is Ozempic. And although I'm talking about Ozempic, I'm really talking about drugs that are similar to Ozempic, and I'll give you the list of those drugs. However, my conversation regarding this class of medications can be extrapolated to medications in general. And some of my stay tuned to the end, I'll share with you my comments in terms of what I think about medication prescriptions and how we should really be applying medication prescription in the clinical practice. I think the way many of us are doing it in medical practice is essentially not only wrong, but I think it's deleterious to our health, to our patients' health, and I think there's a different approach. So hang on to the end. I'll give you my comments and I'll share with you our approach of doing things at Montgomery Heart Wellness. So first of all, let's talk about Ozempic. Maybe you know Ozempic is a commonly prescribed drug for diabetes, for type 2 diabetes, but many individuals use it for weight loss. It has a sister drug called Wegovy. Wegovy is the same molecule, simply a different name. It just has FDA approval for weight loss. But the question I'm going to raise this evening, is it your weight that you're losing, or are you losing your health? Because these drugs do not come without side effects, and I'm going to share with you some insight in terms of what are the potential side effects. Now, if you're ever prescribed a medication, what you can do is go online, because frequently doctors don't give you the package insert, but however, if you get samples of medications, such as these drugs, they often have a package insert in them. And the package insert is a pretty busy sheet, but I've given you a copy of the central part of the package insert of Ozempic. And at the beginning here, it shows you that you have certain warnings. So this little box here, as they call it, the black box warning. And right off the cuff, this black box warning said that there's a risk for thyroid C cell tumors. Now, this was found in rodents, and so they test a lot of these drugs in animals, and they can get some faster results. And so it's been found that rodents have increased C cell tumors of the thyroid. There also may be some medullary thyroid tumors as well. So there's a black box warning saying that humans may be at risk for thyroid tumors. And if you have a history of a thyroid tumor or family history of one of these thyroid tumors, it's contraindicated. There are also other contraindications. Another one is hypersensitivity or allergic reaction to this medication. So if you have an allergic reaction to Ozempic or have had one, of course, it's contraindicated. But there's some other common warnings of potential precautions, side effects. Pancreatitis, or inflammation of the pancreas, is something that's been seen in the studies. Disease of the diabetic retinopathy, so disease of the retina in diabetics. And of course, these drugs are used in diabetics, and diabetics may have early diabetic retinopathy that you don't know about, and you may get started on this drug and it may make it worse. A drop in blood glucose, hypoglycemia, glycemia, especially in individuals who are on insulin or other blood sugar lowering medications, you can have a significant drop or a dangerous drop in blood sugar. And of course, acute kidney injury. And of course, diabetics are at risk for kidney failure. But the most common adverse effects are essentially nausea, vomiting, diarrhea, and abdominal pain, and constipation. Now, aside from these more severe reactions, just think of being nauseated most of the time and vomiting part of the time, diarrhea, abdominal pain, and constipation. These are not pleasant symptoms to have. So there's a nuisance, I should say, to taking this medication. So what's the family of drug? What are some of the cousins to Ozempic? Ozempic you know about. Many of you may know about Trulicity. And here are the generic names. I'm not going to bother you with that. Byetta. These are some of the older drugs. That's Bydureon is a drug that's a long-acting form of Byetta. Victoza, many of you may have been on this drug. Atlixin, I've not seen a lot of patients on this drug. Ozempic, we see a lot of patients coming in on this. Rybelsus, I'm seeing commercials on this drug. I've seen a few patients come in with this. And Mounjaro. Mounjaro is a little different than the others because it inhibits two different receptors. The GLP-1 receptor, it's a glucagon-like peptide 1. Basically, this lives on the pancreas. It helps the pancreas increase insulin production. It also slows down the motility. It slows down the motility of the stomach. So it slows down the food and it gives you a relative constipation, if you will. GIP is a gastric inhibitory peptide. Again, slows down gastric motility, but it also can increase insulin production. So there's synergy in the effects of these two receptors, and Mounjaro is the one of these drugs that affects both. So that's a unique factor in this drug. So that's the mechanism of these medications. So essentially, what's the benefit? By and large, these drugs are meant for type 2 diabetes and weight loss. Now, some have the indication for weight loss, not all of them, but they all tend to result in reducing hemoglobin A1C and also helping with weight loss. So what I'd like to do is say, okay, well, if these drugs are so beneficial, and they're not cheap. I mean, these drugs can be anywhere from $1,000 to $20,000. It varies. And the studies have shown that you have to stay on the drugs for the benefit to maintain. So as long as you're on the drug, you can lose weight. When they discontinue the medication, the patient gain all the way back, and all the problems like poor diabetes control all return. So you must maintain the drug in your system. So what's GIP versus GLP-1? I alluded to that earlier. Essentially, this has receptors on the pancreas, the bone, fat, GI tract, and the brain. And also the GLP-1 receptors exist on the pancreas, the GI tract, as well as the heart and the brain. Now, we don't know the long-term effects on the brain of a heart. We know the effects on the pancreas and GI tract. We really don't know the long-term effects on any of these organs. Most of these trials have only been studied for about a year, as the longest about a year and a half at most. So we only have short-term benefits or effects, I should have said, of these drugs. However, what is the effects of these drugs 5, 10, 15, 20 years? Because they're saying people have to stay on these drugs for life. That's one. Two, these drugs are mostly studied in individuals who are around the age of 56. In most of the studies, they had a small percentage of people who had a percentage who were, I think only 2 to 3% of the patients in the studies were 75 years and older. Excuse me. So that's important to know because right now, the pharmaceutical companies are trying to get Medicare to cover these drugs. Half of the people on Medicare are 75 years and older. So if this drug is covered by Medicare, you're going to be using this drug in a significant number of people who weren't adequately studied. That's one. Two, the other, this drug is also being recommended in children. There's not a lot of data that I'm aware of the long-term safety in children. So we're starting to find, some small benefit over a short period of time, over a small group of population of people, and then we extrapolate it to the world forever. And so this is an unsafe aspect of how we use pharmacological medication. So, but what about someone who has diabetes or overweight and they say, look, I need to lose weight, I'm having trouble? Well, the old-fashioned way is the effective way. And so we have done studies in our clinic where we use a defined plant-based diet, and we provide the food, provide recipes, we provide detailed instructions, because going on a lifestyle change is not something willy-nilly. If your doctor says, well, go and eat healthy or follow this diet or that diet, that's not specific enough. If you're making fundamental changes in how you eat, how you exercise, you need guidance. You need close follow-up. Close follow-up means weekly, sometimes daily in some patients. So what have we done in our clinical setting? We do this routinely. We use a defined plant-based diet. It's in an outpatient setting, so this is not in a laboratory or sterile research setting. It's done in our clinic, and we've tested this over the years, and we've published the results. And so what do we find? First and foremost, in just 4 weeks, the hemoglobin A1C is reduced by 4%, 0.2 reduction in hemoglobin A1C of 5.9. Now, let me explain something. This population of patients were not diabetics. They had insulin resistance. So it's harder to reduce hemoglobin A1C in somebody with a lower hemoglobin A1C. So despite the fact we had a hemoglobin A1C averaging of 5.9, we still had a 3.4% reduction in just 4 weeks. I'm going to compare that to what the drug effects were in patients with a much higher hemoglobin A1C. There are other benefits too: cholesterol reduction, C-reactive protein reduction. So you're having a multifactorial benefit with using diet compared to just one isolated biomarker. If you look at weight, very significant weight reduction. We have about a 6.7% reduction in weight over just 4 weeks. There's also 6.1% reduction in BMI in the same period of time, and waist circumference went down by 5.9%, all within a relatively short period of time. So an effective lifestyle intervention can be very effective, and it's fast if you do it right. And so it takes a little bit of focus and concentration, determination, but you're going to get a much more effective change. And what we find in our patients that once you've done this effectively for 4 weeks, your palate changes. So there's a lower requirement for willpower, if you will, because this becomes more natural to you. And the longer you stay on it, our clinical experience has shown that it becomes much more natural for patients to stay on a regimen like this. Let's do a comparison. So the effects of hemoglobin A1C with the drug versus nutrition. This top bar here, and what this graph shows is the projected percentage reduction in hemoglobin A1C over time. And I did it for a 4-week period of time. So what I did is look at the scientific data. The average reduction in hemoglobin A1C for like Ozempic over a period of about 40 weeks was 2.1%. So if I extrapolate that and say, okay, the percentage per week reduction, we get a 0.052% reduction per week. And so we extrapolate that over 4 weeks, that's a 0.21% reduction over 4 weeks. Compare that to the diet, which has a 3.4% reduction over 4 weeks. And you see a much faster drop in hemoglobin A1C. Whoops, I changed slides. A much faster drop in hemoglobin A1C compared to Ozempic. So defined plant-based diet in the blue, much faster drop compared to Ozempic, much slower drop. We showed you a little sneak preview. Look at Mounjaro. This has the largest drop in weight and also the largest drop in hemoglobin A1C, about a 2.3% over 40 weeks. If you extrapolate that to 4 weeks, it's a 0.23% in 4 weeks, and it's a 0.0575 per week. But again, much slower than just a nutritional regimen alone. And you're not dealing with the nausea, the vomiting, constipation, etc., that you're dealing with the GLP-1 agonists. If you look at the weight loss, the defined plant-based diet had a 1.7% weight reduction per week. That's a 47 times more effective weight reduction compared to Mounjaro, only a 0.38% per week, and Ozempic, 0.23% per week. You had to take 6 months to get, a 1 to 2%, a 6 to 10% reduction in weight. So the thing is, you have a much more effective outcome and much more effective benefit for lifestyle. The problem with lifestyle is that it takes work, it takes determination, it takes effort. However, if you put the work in early on, you get benefit. So what are the issues with medication prescription? The take-home message is the following. The fewer medications you take, the healthier you are. Most physicians are trained to prescribe medications not based on the well-being of the patient, but based on the diagnostic label the patient has. So for example, if you come in, you're diagnosed with congestive heart failure, there's a standard that, okay, this person get these 4 medications. If you have diabetes, you get these 4 medications. And there's little regard to your overall biochemistry, physiology, how well you're doing. We look at the diagnosis, we look at the numbers, and we prescribe based on that. Well, we need a paradigm shift. Medication need to be prescribed based on only acute need, and they need to be weaned as fast as possible because these medications have numerous side effects. I mentioned to you the side effects with the Mounjaro. Most medications are studied for a short period of time, but they're prescribed for a long period of time. So the adverse effects of these medications are unknown over time. And so most people are taking medication for 4, 5, 6 years, and we don't have adequate data on these medications. And so if you come in with 4, 5, 6 medications, many of your health problems may be related to the medications. My team and I are getting ready to publish a case series of heart failure patients who came in, and they were all on guideline-directed medical therapy. They still had severe symptoms of heart failure, disability. When we put them on the defined plant-based diet and other natural integrative therapies such as sauna, ozone, and other infusions, we were able to wean the medications off, and the patients became much better clinically. We had one individual who's wheelchair-bound, oxygen-bound. She's now walking on beaches. One guy's doing up to 20 burpees without chest pain. So the patients are doing much better clinically on fewer medications with a defined plant-based diet. So I want that to be the take-home message. You have to do the work. And if you need help from us, you know how to find us. Go to montgomeryheart.com. Email address and our phone numbers there. Call us if you need help and instruction. We work with patients from all over the country. I have international patients on our online programs, and we have a program for you. So until next time, we want you to take care and work hard to improve your lifestyle, because that's something for your body, and that's the only place you have to live while you're here on earth. Take care.